Hey, hello, everybody. First, I want to thank the Informa team for getting this together. I'm excited to be here as part of the product and innovation team at Woven Health Collective. Today, we're going to focus on different ways that modern tools can add value to Speaker Bureau, and that ranges from simple AI chats to more sophisticated solutions that I'm pretty excited to show you. Since this is a webinar format, I will be jumping back and forth between a presentation and some web-based AI tools to give some live demonstrations. So if the technology cooperates, as sometimes it doesn't, we'll have some fun together. Let's jump in. So this is what we're going to cover today. First, we're going to talk kind of about where generative AI stands. Spoiler alert, it's gotten really good, really fast. And then I'm going to share a bit of a practical framework for how you can actually implement these tools in business in a safe and exciting way. And finally, I'll share something new in speaker training that we think can really change our approach for the better. Now, one thing that's been excited for us as a service agency is that even just over the last 6 months to a year, AI has become kind of a constant thread that runs through everything that we do, from research, content development, compliance to training programs. The key here is we're not talking about future possibilities anymore. We're talking about what's working right now. So speaking of what's working right now, going to show something pretty fun. Conversational AI has gotten extremely good. And there's something about having a conversation where somebody talks back. And so I'm going to just give a little example here before we get moving. All right, let's get a little advice from our friend Gemini. Hey there, Gemini. I'm actually delivering a webinar right now to folks in the biopharmaceutical industry. We're talking about how people can use artificial intelligence to help deploy speaker bureau programs. Do you have one quick point that I might want to make sure to share with everybody today?
Absolutely. A key point to emphasize is that AI can significantly enhance the efficiency and effectiveness of these programs. By leveraging data analytics, AI can optimize speaker selection, streamline logistics, and provide deeper insights into program performance for better decision making.
Now, you and I didn't collude before this conversation, right?
No, absolutely not. Our interaction is happening in real time, with my responses generated based on your questions just now. There was no prior arrangement or collusion.
We believe you. Thanks so much. Let's head on back. Now, I know sometimes AI demos can almost feel like parlor tricks, but there's something really important underneath this. For the last few years, we've been seeing a lot of presentations about what AI will become. And the reality is, when there's a lot of hype, when the expectations are high and the transformations are big, they also feel more daunting. But the good news underneath it is that the technology itself has evolved so quickly that the changes in just the last 6 months in terms of what you have access to with very, very basic chat tools is really astonishing. I'm going to give you one example, and it's pretty crazy, but this is from 2023, so it almost feels ancient in terms of where the technology's gone. But JAMA did this really cool study where they asked patient questions of both physicians and a chatbot. Now, this is not a special trained model. This is not customized. It was just ChatGPT. And in almost every case, the GPT provided both more accurate and relevant responses, as well as more empathetic, human empathetic responses than the physicians did. Now, I'm not saying that chatbots are going to be replacing physicians anytime soon, but their ability to understand and respond to complex topics in accurate ways has been growing really substantially. So let's try an example. We'll do a little prompt and let Perplexity, which is an AI platform, do a little bit of work while we talk. This is a concept of giving a very complex task in a single prompt. So I'm going to take a transcript of an FDA advisory meeting, maybe 58 pages of transcripts, and ask it to create an attractive, interactive dashboard. So I'm going to ask it to code for me. But the key thing is I'm asking it to complete 6 steps in order without me stopping in the middle. So we're going to try to have it determine a key topic categories from the transcript, some subtopics, create a summary of each one, pull some direct quotes, and ultimately create an app. Let's see how that goes. Here we go. So this is Perplexity, and they just came up with this really cool thing called Labs. And what it does is it takes a prompt and it makes kind of a complex project in a number of different steps. So I kind of cheated and put the prompt in that I showed you before. I added a few rules that I just want to make sure that for each key point, there are 2 quotes. I even asked it to try its best. You'll see here that I've loaded up a style guide with different colors that I like and a transcript from the FDA. So let's get this one started. And as you see, the first thing it does is says, I'm creating a plan. And about 10 minutes later, it says it'll be ready. So we'll check in on them in a little bit. Let's head on back to the presentation. So one of the interesting things that's happening right now in certain pockets within life sciences is that there's a bit of a disconnect between what leadership feels is important and what's happening kind of at the line. And there's been an evolution. In 2022, we actually did a survey where only about 11% of managers in life sciences felt that there was a management directive to explore AI. Fast forward to 2025, and there's this really cool Deloitte survey where life sciences CEOs cited the patent cliff, pressure from DTC drugs, regulatory changes, and customer needs as being less significant than Gen AI at that time. And that's really evolved into the point where, particularly in biopharma, this is a survey that just came out this month from ParExcel, that adaptability to new technologies in AI was the number one item cited in terms of what folks are looking for in hiring in research and development, even more than scientific and therapeutic expertise. I don't think this means that it's more important, but it's a skill that's on people's minds a lot more. At the same time, when we look in commercial, not everybody's feeling this. And this was done earlier in the year in Philadelphia at the Informa Speaker Bureau meeting. And this was just the audience members there, a nice cross section of teams. And the number one answer to the question, does Gen AI actually make a meaningful difference in Speaker Bureau? And most folks are saying, not yet, but I'm optimistic. And it feels like we're going on the right path. And I would hope we look back a year from now and folks are really moving kind of towards the right of that chart. So let's look at something a little more focused to Speaker Bureau. I think this is a really fun exercise. We're going to make a dashboard, but it's going to be the curious case of the phantom meals. And what you see here is kind of a fictitious spreadsheet of 300 meetings. So these are speaker meetings, and we have the district, the region, the field representative, how many RSVPs there were, how many sign-ins, and then the number of meals that were purchased. And of course, we have some really great venues. Nobody Orders the Chicken, Fair Value Steaks, Mama Leone's Reasonable Meals. That sounds like a great place. So we have all this data. And what we're going to do is use this prompt here. So it's saying you are a biopharma speaker program compliance expert, kind of provide the context. And we explain that there's a data set, what compliance looks like, and that we want a visualization. We're going to use Claude for this one. Let's take a look. All right, let's give Claude a spin. Here we have kind of Anthropic's interface here. This has the Claude models in it. Now, what we're doing, you can certainly do with ChatGPT or anything you have access to. I just pasted in our prompt. Let's drop in that data set and get it going. And what you'll notice is it instantly starts to analyze it, starts to code, looks like it's going. And the cool thing about Claude and Anthropic is it has a really nice preview. So you don't even need to know how to execute the files. It just shows it to you right there. So we'll check in on Claude in a little bit. So while that's cooking, let's take it down kind of the next step. We talked about this tension between excitement and adoption. And we see the data. I mean, we know everybody's very excited about the possibilities, but at the same time, adoption has been slow in certain areas. What kind of explains that gap? Well, here's a couple of things that might be. First is accuracy. Can we actually trust the model's outputs? At this point, we really are starting to understand that sometimes using AI is like working with an intern that sometimes lies, and you can work around that. Just like humans, AI can be wrong, and building your systems around that fact is one way to kind of get around that. Then there's data security, right? Handling of sensitive information is a risk, but the frontier models at this point have really figured security out, and incredibly sensitive applications are using AI on a regular basis. Then there's fluency. I mean, you do need skills in immersion and kind of muscle memory in order to use AI correctly. And so building those skills is incredibly important. There's also, of course, restrictions. We've seen those early AI policies where it's like, hey, you can use AI, but if you use it wrong, you're fired. What do you do, right? And companies have come a long way in terms of putting really smart, easy to understand, and reasonable policies around AI. And then finally, there's this kind of level of mistrust, right? There's some data in industries, maybe outside of life sciences, that up to a third of employees are using AI without telling their organizations. And essentially normalizing and rewarding the use of modern tools to make work more valuable and better is something that companies are starting to embrace. So the shift is coming fast. And one of the reasons is, our businesses, particular in biopharma, feel that AI will drive over a 10% revenue increase while reducing costs by 10%. So when leadership says this is going to be the impact, it's going to be pushed through the organizations. So with that, I'd like to provide a bit of a framework for adopting new technology that really provides a way forward that you can kind of take incremental steps and start to see value without diving in too deep into the deep end. The first thing is Ethan Mollick, Professor Mollick. If you don't know him, his blog is here on the screen. Definitely follow, definitely get the book. It's totally worth it. He provides 4 essential rules for AI in work and life. And if you can just adopt these things, you will see a major, major change. Rule 1 is always invite AI to the table. This means integrate AI into your daily tasks. Know when to hold them, know when to fold them, know when to walk away, know when to run. Be the human in the loop. AI supports, but you're always in the lead. Treat AI like an alien, not a machine. A lot of people think that they're coding when they're talking with LLMs or large language models, but it's more about talking to an alien that's been observing humans but doesn't quite understand it and needs things explained a certain way. And then finally, and this is absolutely true, you do assume this is the worst AI you will ever use. It will only get better. Now, if these are the rules for kind of how to interact with AI, we've developed kind of 6 principles, or what we're calling the 6 factors, for creating inertia within an organization. And this is about selecting a strong AI project or use case to start building successes. On the left side, we kind of have the items around conceptual appeal, right? Is this use case simple to understand? Does it provide value? Meaning, will there be clear, tangible, measurable benefits? And is it exciting and buzzworthy, right? You want to build advocacy and momentum for what you're doing. Now, on the other side are the factors of practical feasibility. Is it easily deployable? Does it integrate smoothly into our workflows? Is the technology reliable? Does it have proven and trustworthy performance? And then finally, low risk profile. Does it mitigate legal risks, regulatory or operational concerns? And if you pick a project that really kind of hits on all of these, you're in a good shape to be making the first step. So, with that said, we had some things cooking, and I think it's time to play. Let's first of all check in on Perplexity and see how it's doing with that FDA ad board. So it looks like we're making some progress here. What's really cool is that it's thinking it's doing many, many steps without any kind of inputs. I just kind of gave it a very brief description of what I wanted done, and it looks like it's doing a lot of coding, taking individual steps, looking at the data. Let's come back to it. So next, we're going to talk a little bit about the ability of AI to kind of interact with the outside world and the physical world. One of the things that these applications have been becoming increasingly good at is taking inputs like video or live stream, audio, images, and interpreting them in a very natural way. For example, I had a Gemini app on my phone that was able to help me figure out how to fix the plumbing under my sink just by me showing it what was going on under there. In a similar way, you can load images and mixed media and have it interpret it in helpful ways. Let's show you a couple examples of that right now. Let's give our friend ChatGPT a chance here. So here we've got ChatGPT, and what I'm going to do is I'm going to load up a presentation from the FDA. And I'm going to show you a slide or two here. So we've got this slide here, which has the location of API manufacturers, a couple of pie charts, and we've got this texty slide. Let's do two different things where we're asking more or less for the AI to look at what it's seeing and tell me what's going on. So let's take that pie chart and load it up. And I'm going to put a little prompt in here saying, look, here's the presentation. I have one specific slide. Help me understand what it means and put the data in a nice table. Let's see what it comes up with. It's reading the documents. And here we go. So it's explaining what's going on, but more importantly, it's able to look at the data from a picture and put it into a nice table for me. So this is a nice way when you get slides or materials that you really can't copy and paste. Computer vision will actually transcribe it for you and actually take data from one format and put it into a different format. So let's take that other slide, which is a super texty slide here, drop it in. You can say, oh, there we go. You can say, can you please rewrite and reformat this slide to be better organized and easier to understand. So now it's going to be looking at the visual formatting, the words, the messaging, and here we go. It's taking it into bullet points, creating more subheadings, highlighting certain words, and that all came from an image. So we're using computer vision quite a bit to either interpret and transcribe data or look at certain things like formatting, visual design, and other things like that in improving content. So that's a really cool use case for computer vision. And let's head on back. All right, let's go back to that compliance use case that we showed before. So we want to know how we're doing in terms of sign-in sheets versus meals. We want to make sure that we're doing things right. Of course, this gets me every time. This is, of course, generated by ChatGPT 4.0. It's one of our illustrious venues for this activity. And we're going to see what kind of dashboard Claude was able to put together. Let's see here. All right. Here we go, chicken on Claude. And here we go. Man, this just gets me every time. We've got ourselves a dashboard. Let's see here. We've got compliant rate. 78% of meetings are compliant. I'd rather that be 100. 300 meetings. Total number of excess meals. Let's see, we've got compliant and non-compliant meetings. Regional. So let's see, can I click here? Southeast. Oh, here we go. We can look at the districts in the Southeast. We've got specific representatives here. We've got auditor notes. We've got our digital auditor here. That's cool. Let's see, we can look at representatives across the whole country. Robert Brown's getting an email tomorrow, and Patricia might be getting an award. Certainly this doesn't work out every single time, but wow, this type of thing with a single prompt and a little bit of data and the ability to visualize and understand what's happening is really, really powerful. I love it. So let's go back and see what we've got. And for the last one, you recall we were checking in on Perplexity and how it was doing on that project around the FDA advisory board. So we're going to check in on Perplexity. This is actually my dog, Harley, produced in the Perplexity poster maker. So she's looking good. And let's see how the dashboard came out. All right, let's check in on Perplexity. Now, you'll remember this was a very complicated task. We gave it 50 pages of text and we asked it to go through it, come up with topics. And let's see, we have an interactive dashboard here. It figured out the topics, it summarized them, and it created an interactive dashboard. But this was really a 5 or 6 step process. And under the hood, you can see, let's see here, it did quite a lot of coding that you don't have to worry about. Now, I did cheat a little bit, and I made one of these earlier that we can make big and look at it. And it definitely followed all the instructions. We have our topics. We can look at each one of them. Within each one, we have a summary. We have the component messages summarized with key quotes. And you can go through each part of the meeting, and it's really well organized. I didn't give it anything but that one paragraph earlier that you saw, which is really pretty amazing at this point. And we've got some key takeaways. Now, realistically, are these going to be perfect every time if you're trying to just put a one paragraph prompt in and get something perfect? Well, the answer to that really is no. But what I'm about to show you is something that, quite frankly, is correct every time and can be really transformational for how we work with speakers and how we think about speaker training. Let's take a look. So far, we've kind of been focused on basic applications that can be done in a chat or prompts within a basic LLM. And the reality is 30, 40% of your tasks on a daily basis can probably be moved along, sped up, or improved with that type of engagement. But at some point, you want to get a little more sophisticated and think about solutions that can solve more mission critical items and that are even more exciting. I think there's a lot of opportunity in Speaker Bureau for a few reasons. One, there's high compliance scrutiny. It's very important, particularly in speaker training, that you meet very strict regulatory standards and you want to confirm that your training actually works. It involves very important relationship. Like, these are some of the most influential voices in healthcare. You do have limited time and resources, so efficient training can improve program execution. And then finally, making sure that speakers can deliver a message effectively is very important to program success. So if there's anything we can do to kind of streamline, personalize, and optimize this, it's a benefit all around. We partnered with a fantastic company called Copian AI that built a wonderful solution for helping speakers actually engage with content in a way that allows us to understand how they deliver the content, for the speakers to actually get some practice delivering that content in a completely safe way. So more or less, this is a sophisticated natural language processing and generative AI application that combines two unique experiences together. One is that speakers can kind of practice delivering slides and presentations to an avatar, and the system can transcribe and analyze that. And then the second is creating a virtual two-way conversation with kind of a virtual audience where they can address key questions, and then the AI will listen to those answers and be able to provide thoughtful and meaningful follow-up questions. There's a number of layers of value for this. I mean, for the speaker, just the ability in a safe place to practice delivering the slides and gaining confidence with new data is a great thing. They can rehearse Q&A for real-world scenarios and receive critical feedback if you want to provide it that can help them improve their presentations in the future. Now, for teams, this does a number of things as well. It's a completely automated way to confirm that all the training that you spent that time on actually worked and that speakers are able to deliver a compliant and effective message. The transcripts are able to be reviewed for deeper content insights, and you can do that longitudinally across your entire speaker bureau. So let's say everyone in the speaker bureau engages with a 20-minute conversation, and now you know all the different ways that they answer questions and deliver the slides. It can allow you to measure and improve your content over time. One of the great things about this is that it's pretty simple to deploy. And more or less, it's just trained on your approved content and program goals, which you already have. The speakers engage with the system either in the comfort of their own office or home, or even at a live event. And it can be delivered through your learning management system or just a simple link. It can provide reinforcing messages and feedback to your key opinion leaders and speakers, or deep insights to you as the sponsor. And then finally, because now you have all these transcripts and all of this data, you can have AI-driven insights to plant seeds for future activities and content and really let the value snowball. All right, I'm about to show you a little bit of a video of what this looks like in action. I'll kind of set the table here. Imagine you just did your compliance training and it's an asthma program, and you want folks to know that privacy rules always apply. It's very important that that happens. So if you're asked a question that has maybe patient identified information or is asking about a specific case, they've been trained not to do that. And let's see what an engagement with the Copian AI solution might look like.
Hello. In this session, you will practice delivering approved slides and responding to questions about that content. Let's start with the presentation. Once you're complete, you may begin the QA section by saying, "I'm ready for questions." Let's begin.
Hi there, I'm Bart Zoni. Today we're going to be speaking about the NAEPP Expert Panel Report number 3, which provides priority messages for asthma control. More specifically, we'll be talking about priority message number 1, which refers to controller medications. This is a very important one because it really talks about the long-term outcomes of patients. Now, controller medications should be taken on a long-term basis. That helps patients control persistent asthma and avoid things like hospitalizations, day out of work and school, and other outcomes that people really want to avoid. Inhaled corticosteroids have consistently been proven the most effective therapy for that long-term control. One of the early studies by Donahue in 1997, where we started to really understand the effect of inhaled corticosteroids, what you see here is that as more canisters between 0 and more than 8 canisters were prescribed in a year, patients taking inhaled corticosteroids had a essentially 0 relative risk of hospitalizations, while patients who only had beta-2 agonists had an elevated risk of hospitalization the more canisters they required in a year, and that effect was seen across all ages. I'm ready for questions.
I've stopped the automatic recording. Thank you, Bart. Now I will ask you some questions. To answer, hold down your spacebar to speak and then let go the spacebar when you're done speaking. When you're ready, hold down the spacebar and say, "I'm ready to begin," then let it go.
I'm ready to begin.
In the hospitalization study, it's unclear to me if the use of beta agonists are causing those hospitalizations or are just failing to prevent them. Can you elaborate?
I don't think this shows a causative effect between the beta-2 agonists and the hospitalizations. I think what we're really seeing there is as more rescue inhalers were needed, we're looking at people with more severe disease that was not addressed by those medications.
That is interesting. You noted that the study doesn't imply beta agonists caused hospitalizations, but did it speak to whether or not they provided any protective benefit versus no treatment at all?
I think this might have required a control, and taking rescue medications away from people at risk of hospitalization and death would have been unethical. Later studies kind of looked at that, and I think what we know now is that long or short-acting beta agonists, when taken alone, absolutely do not reduce the risk of hospitalizations. And even with the long-acting beta-2 agonists, there's a black box warning, which shows that when they're used as monotherapy, it may actually lead to untoward outcomes.
Thank you. Here's the next question. I have a patient, Mary, who is 17 years old and seems not to tolerate inhaled steroids. I've tried 3 times and it's frustrating. How might I handle this case?
Well, I don't think it would be appropriate today for us to talk about individual patient cases. So I'd like to answer this question maybe a little bit more generalized. And that's if you have patients who, for any reason, can't use inhaled corticosteroids, which are the gold standard, there are other long-term control medications to select from.
Thank you very much for your time, Doctor. We'll reach out in the next few days with next steps.
Now that you've captured that interaction, you can do a lot of very creative things with it. It's really just limited by your imagination. Here's just one example of a scoring rubric where you can actually take the answers in the slide presentation and kind of score them against some type of predetermined rubric. Or you can just provide reinforcing messages. They might be pre-written if the legal and compliance team prefers the AI not to be generating content. You can take these pre-written statements that are triggered based on what it detects in the analysis and show that to the physicians, or you can send separate reports to the internal team to ensure that compliance was met and to the physician speaker in order to reinforce those messages. The beautiful thing is that having these transcripts provides you with semi-quantifiable trend analysis across the entire speaker bureau. And it moves beyond subjective evaluation to more data-driven insights on speaker performance. Now, when we think about this activity against the 6 factors that we described before, I really do think it hits on all of these. It's a very simple interface. It's just like speaking with a person. There's no really special in-house technology that you would need to deploy it. It's valuable because it not only confirms training effectiveness, but it provides deep insights to how content is delivered. It's pretty cool. So it's fun and meaningful. It's novel use of Gen AI activities. Deployable, meaning you can just have someone click a link at home. You can do it during speaker training events. It's reliable. Copia and I is a very proven platform, A+ support. And from the Woven team, we've been doing Speaker Bureau for over a decade. And from a risk perspective, if you really think what's going on under the hood, not only are there significant guide rails for the AI, but it's mostly just listening. And it's asking questions, listening to the answers, listening to the slides. So even though it's a very engaging experience, the guide rails are very easy to put in place. So if you're curious about this or some of the other things that Woven's doing or anything that you saw today, just reach out to me. I'm on the technology and innovation team here. I've got my email address. I'd love to talk. And if you'd like a demo, we'll do that too. I hope that today you were inspired a little bit to head on back to your LLM tools that you have access to and maybe do something fun and interested. I'd love to hear about it. So I think that's it, and we can do some questions.
Our first question is, I noticed that you were using some relatively simple prompts in your presentation. I've been reading a lot about using very detailed, structured prompts to get better results. Is that how it works?
You will notice that I probably went a little more on the conversational side for this presentation, and it might have been just for practical matters, just fitting everything on the screen and keeping it simple. But there's certainly 2 schools of thoughts. In general, very conversational, just kind of talking back and forth prompts can create situations where the AI is a little more creative, thinks outside of the box. It can be very, very productive for certain applications. So certainly you don't need to have very complex prompts every time. Now, as you need more structured outputs or you want the AI to complete more steps, it certainly helps to be more structured. And there's a lot of methods for creating those out there. We use those too. One I like is called the parse method. That starts with a persona and an activity. So we actually have a little bit of tooling where the AI will ask you questions and then generate a really nice prompt based on your answers. I think we're actually going to be sending an email after this event to the folks that are on, and maybe we can put the prompt that actually is the prompt generator that you might be able to use if that's useful. Next question.
The next question is, I think the speaker training program looks really interesting, but can imagine something like that being a little difficult to get through medical and legal review. What's your experience with that?
So certainly understand that getting something new and very different and technology based through layers of review can be challenging. And we're used to that. And the two main layers are a technology review where the company needs to understand that the AI policy is being met, that there's data security and that kind of thing. And getting in front of that is very important. And when you're looking and evaluating different AI platforms, knowing that they're able to get through that step is important. And then in the actual program execution, bringing the medical, legal, and regulatory team in early to do a concept review and to think about all the things that are important, the questions that they have, and getting everybody comfortable with how the program works is very important to program success. The other thing is, particularly with the activity you saw before, there's a lot of levers that you can pull to kind of ease some of the tension. So, for example, you can have the questions be pre-scripted, or you can have the questions be AI generated. And kind of negotiating how that works and what the guardrails are is something that you can get done to make sure that the program has a lot of value, but the review teams kind of feel comfortable with that. And maybe let's just do one more.
The question is, I think these AI tools are very exciting, and our team has access to AI, but we're just not seeing really strong adoption. What might prevent this?
We did talk about kind of at a organizational standpoint what some of those barriers were before, but kind of on the personal level, it's a little bit different. And there's kind of this typical journey with AI where there's curiosity, kind of playing with prompts and chats and kind of trying to do different things with it. But as you start to try to really implement it into work, there's kind of this phase where it starts to disappoint you, and where AI disappoints you, it creates frustration, and kind of pushing through the other side of that is really important. From our own data here at the agency, it's kind of this 3-month process of immersion where people just need to, at their own pace, learn, bring AI into their tasks, understand what's working, understand what's not, ask questions, have peer support. But typically what we've seen is that people who might use AI tools 1, 2, 3 times a week can be using it up to 7, 8 times a day if they kind of stuck with it for 3 months. And kind of that personal journey of pushing through the other side and getting to a place where you go from this is cool and interesting to this is frustrating me, I don't know how it'll ever work, to this is something I need in my life, or I don't know how I get through my day, is a bit of a journey. And, I just invite everybody to kind of take that journey because it's really rewarding at the end of it. So again, thank you so much, everybody, for your time. Really appreciate you listening, and I hope you do some wonderful things with AI. Take care now.